The decision to have breast reconstruction is one of the challenges that a woman faces when she's been diagnosed with breast cancer. There are different viable options, so we decided to bring in a couple of doctors here, surgeons, that can help make that decision. Tell you about a special event that's going on at Garden Park coming up in just about, let's see, October 12th. Dr. Paul Mace, general surgeon, Dr. Michael Diaz, plastic surgeon. Good to have you both with us this morning.
Thank you. Good to be here.
Well, thank you very much. This event coming up on October the 12th at Garden Park is a great event for anyone who is even is going to have to deal with it, has dealt with it, or whatever. You'll be talking about some different things. Tell us about the things that you deal with and what women face when it comes to having breast cancer surgery.
Well, the biggest decision is choosing a treatment plan that's right for the individual woman. There are a myriad of different options out there. Some involve limited surgeries, some involve more extensive surgeries. It's part of the education process we go through with women when they are diagnosed with breast cancer to make sure they understand those options, to make sure we help tailor those options to what will suit them the best, both for the treatment of the breast cancer and also afterward achieving the best cosmesis so they have a good sense of self afterwards going forward with life.
Now, talking about the different types of surgeries that are involved, I know there's radical mastectomies, there's simple mastectomies, lumpectomies, that, so they have all these different choices. And I guess a lot of it depends on, that's when, they work with their surgeon, with their doctors, their oncologists, and find out exactly what they need to do.
Well, early on in the 40s, 50s, things were all radical mastectomies, very large disfiguring surgeries that had very poor cosmetic outcomes. We evolved from that into doing more limited mastectomies that had a little bit better cosmesis. Then we started trying to add reconstruction into the mix. The early efforts with reconstruction weren't quite as satisfying, so then we started trending back into doing lumpectomies and radiation, trying to salvage breast tissue, but then we started running into long-term issues with irradiated tissue. So now the pendulum has swung back, and also now we have gotten to the point where we can preserve more of the skin envelope, the nipple and the areola, and take out the underlying breast tissue with preserving those structures, put an implant in or do a tissue transfer flap, so we're getting much better cosmetic results. We're getting good treatment of the breast cancer. That's our priority, is treating the breast cancer, but then we're getting better cosmetic outcomes on the backside, which makes the patient happier overall.
Well, Dr. Diaz, let's talk about some of the cosmetic options that they do have now. I mean, I have dealt with someone personally several years ago that went through the surgery, and it was interesting to me because the surgeon walked in. This was in another state. Surgeon walked in, did the surgery, the mastectomy, simple mastectomy. He walked out. Plastic surgeon walked in, put a tissue implant in there, and went on from there. So that's one option.
Correct. There are a bunch of options. You can have implant-based reconstruction, or you can have what we call autologous tissue reconstruction, which is using your own tissue. We have really evolved, like Dr. Mace had alluded to, with the reconstruction efforts. And now we're offering an option that the patients can use their own tissue. And you use your own tissue, places that you don't want it anymore, we take it and we put it where you need it.
The tummy tuck flap.
That's correct. And Dr. Mace and I are the only ones who are offering this in Mississippi currently. It's revolutionary, and it's something we're offering to the people here locally that they don't have to leave the area. Lots of times when you're talking to your patients and they have the diagnosis of breast cancer, it's a lot for them to swallow. And in the past, to get the state-of-the-art reconstruction and surgical oncology treatments, they would have to leave the area. We offer it right here, right now, at Garden Park. So they don't have to leave. And it's a comforting measure for the patients to where they can still maintain their family support here locally.
They're still at home, basically.
They're still at home. It's a tremendous load for the patient to hear that word, you have breast cancer, number one. And number two, what do I do? Where do I turn? What options do I have? And that's what we're trying to do. We're trying to comfort the patient that, hey, look, we've got you. We will walk you from step A to step Z right here at Garden Park Hospital. And we have everything to offer. And like Dr. Mace was saying, we can tailor it to what your body is asking for. We have all the tools in our bag that we can offer every treatment modality.
Well, there's a great event coming up on Thursday, October the 12th at Garden Park Medical Center in the front lobby. It starts at 6 o'clock with a vendor expo. Any vendor having to deal with surgeon, plastic surgery and everything having to deal with breast reconstruction. It's basically a breast reconstruction awareness and education event that is open to women, who are maybe going to go through that, or a family member someone that's going to be going through that. Hors d'oeuvres, door prizes, a photo booth, home-based business expo, VIP physician lounge. And you'll find out more about the reconstruction that is available to you. I know that both of you are going to be doing, talking to the crowd around 7 o'clock that evening, and talking about, what the options are, what you have to deal with. And one of the things that you'll be talking about is the tummy tuck flap, which is one of the new. And let's see if I can find the DIEP, the deep inferior epigastric perforator.
That is correct.
That's quite a name to use for something like that.
And that's right on what we were talking about. We offer state-of-the-art, the most modern treatment for reconstruction right here, and it is using tissue from your tummy. You're basically getting a tummy tuck and breast reconstruction at the same time. One of the other questions I'd like to get out there is that a lot of patients ask, hey, is this covered by insurance? One of the good things that Congress has done in 1998, they actually passed a law stating that all women have the right to all treatment modalities for breast reconstruction. And that's one of the things we want to do at this event. We want to educate the public that yes, you can get reconstruction. Yes, insurance does cover it.
And that gives women great peace of mind. It really does. So again, we want to mention that is coming up on Thursday, October the 12th at Garden Park, starting out in the lobby, beginning at 6 o'clock. The doctors will start talking about around 7 o'clock. A lot of great educational information to find out whether you're going to be going through breast reconstruction or breast cancer surgery, or someone. Please come out and see them. Again, it's going to be Thursday, October the 12th at Garden Park in Gulfport.